Hi, Dave with Align Therapy here. I'm going to talk about how to release the piriformis muscle and the deep hip muscles on your own without needing to go see someone and have them dig their elbow into your hip. This is something that we see very common with sciatica and with low back pain, that the hips get really tight, and sometimes it really can help to loosen up those hip muscles. So let me show you how to do that. We're going to need a lacrosse ball, and that's pretty much it. That's all we're going to need. So if you don't have a lacrosse ball, you can use a tennis ball. Golf balls are a little hard and a little small. Lacrosse ball actually works really well because it's pretty dense. Something similar will work just fine. So if you haven't subscribed to the channel, feel free to subscribe to the channel. I'll give other tips and things like that with simple things that you can do to reduce pain. So what we're going to do is we're going to take the lacrosse ball and you're going to lay on your back. So as you lay on your back here, you're going to take that lacrosse ball and you're going to put it right back where the piriformis muscle is. If you're wondering where that is, it's pretty much right in the middle of the glutes. So you put it right here and then you're going to roll over onto it so that you're putting pressure down into that ball. So I'm just shifting my weight over so that my weight then goes right over that. And I'm pretty tender there actually. I'm just letting that pressure release that muscle, and then you can kind of go back and forth, oscillate back and forth on it. And then you can move it to a new spot, go over, you can even put that leg straight. I don't get as much pressure with that, so leaving your knee bent so that you can kind of just crank right into that muscle. And then moving it to a new spot. So we're trying to go all the way around those glute muscles and even deep right in the center to really get some pressure on there. A couple of tips: the firmness of the ball is helpful, but also the firmness of the surface that you're on. If you're trying this on a bed, you might get enough pressure to do that, but doing this on a harder surface, like this table's even a little soft, a harder surface will put more pressure into that. I would usually do this on both sides as well, just to keep you even. If you're having sciatica that goes down the leg that you're working on, sometimes if you get too much pressure right in the middle of the glutes, you'll hit the sciatic nerve and you'll feel that nerve pain down the leg. Back off a little bit and kind of work the areas around that. And I'd probably do this for 4 or 5 minutes, just trying to loosen up that spot. Don't go too aggressive at first until you know how your body is going to respond. So take a few minutes, feel how that does with maybe even a softer ball. Maybe a tennis ball would be good to do at first, and then work your way to a firmer ball and go gradually. If it feels like it's increasing the pain, you might be going too aggressive, or it may be coming from somewhere else and you need someone to look if that's the case. So if you continue to have pain even though you're doing this, definitely consult your physician. And I would highly recommend to work with a physical therapist that knows what they're doing with spine and sciatica and hip pain. And hopefully this helps. Leave some comments to let me know how it goes, and we'll see you next time.